Hello, my name is Katie Hannant. I am the clinical respiratory lead for Frimley, and I am a respiratory nurse. And this is a really short webinar on hay fever, although it's freezing today. So although it's March, we are going into that hay fever season, and we will hopefully get some more warmer weather. So this is just what to do if you have hay fever and also asthma, or one of your children has hay fever or asthma. So let me just move my slide across. So we know that with asthma, there are key triggers that make your asthma worse. And if you are asthmatic, it's really good to understand what those triggers are. And we know that a lot of children do actually have hay fever as one of their triggers, or allergic rhinitis, as the medical term is. And this is where you have an allergy to pollen. So it can be to lots of different pollens. It can be to grass pollens. It can be to tree pollens. And if you have hay fever, it's a good idea to go to your GP to get an idea of what actually you are allergic to. So you can either do that as a skin prick test, if that is offered, or you can have a blood test for an IgE level, or you can have a RAST test, and that will look at whether or not you've got any allergies, and then it will go down into what you're actually allergic to if you have got those allergies, and it will tell you that you're allergic to this type of grass pollen, and so they are a good idea to get, or if one of your children has got hay fever, a good idea to go and get a blood test or a skin prick test to see what you are actually allergic to, and it might just help you to try and avoid that allergen if you can. So the symptoms of hay fever are that you get obviously a lot of itching, and so you get often an itchy nose or an itchy throat, and you can get itchy ears as well. And we know that if you've got a lot of inflammation around this sort of area of your face, or your nose and your mouth, we know that that inflammation often does track down to your lungs as well if you're asthmatic. So you might get shortness of breath, you might get a cough. And if you're asthmatic, these symptoms get worse, and your asthma symptoms can get worse as well. So you can get a tightness of, tight chest. You can go in and have an asthma exacerbation because you've come into contact with hay fever, or your hay fever is uncontrolled. This is a really short video on from Operation Ouch about asthma. So it's really good for children to watch because it just gives it a bit of a fun view on what hay fever is.
What happens when I get a stuffy nose from hay fever? Oh, quick, twist the tissues! Achoo! Oh, that's better. Hay fever is also known as allergic rhinitis, and it's your body's response to certain allergens, particularly pollen. When you breathe in pollen from trees or flowers, your body mistakes the pollen for an infectious bug, and it releases a chemical called histamine to protect itself. Histamine is what makes your nasal passages inflamed and swollen, and they release more mucus than usual. This is why when you get hay fever, you get a stuffy, itchy nose, and you also sneeze a lot. If you're really suffering, there are lots of things you can do, including taking drugs called antihistamines, which prevent the symptoms caused by, you guessed it, histamine. And if you're really miserable, remember to speak to a grown-up. They can often help you figure out what to do. Take care of yourself, and don't forget to stop and smell the... No, actually, don't smell the flowers. What happens when I get a stuffy nose from...
So there you go. So that's what obviously hay fever is. And obviously taking antihistamines is one of the main kind of like treatments that you can, or trying to avoid pollen. But we know that in the summer we want children to go outside. They've got to go to school, all of those things. So they are going to come across pollen. So it's I will go into ways in which you can kind of reduce those pollen loads as much as possible. But really, if you have asthma, one of the main things you can do to really help your asthma care is to get an asthma action plan, and you can get this from your GP or your asthma nurse, and they will go through the asthma action plan, what your triggers are, and what you can do to actually help alleviate those triggers or make them easier to deal with. And then an asthma action plan is like a traffic light system. So green is for go. That's like when your asthma symptoms. We know that with children with asthma, they have episodes where their asthma's worse and episodes where their asthma's better. So it's episodic, and it also varies a lot as well. So this is why that green is just like a normal day to day when your asthma isn't playing up, and what you can do to really alleviate those symptoms. So that would be your normal asthma care on a daily basis, and then what symptoms to look out for when your asthma is getting worse, and then what to do if you're having an asthma attack as well. And if you look at these airways, if we overlap these airways onto the asthma action plan, you can see where they're kind of like stemming from. So these airways are tiny airways in your lungs, and you can see that when you've got no asthma symptoms and your airways are wide open, you don't have a cough, you're not wheezing, you're not short of breath, they are all, that's what we want you to be like. So taking your preventer medication reduces that inflammation inside your airways. And then when you're talking about your blue inhaler, so which is your reliever inhaler, so this is the one that's treats your symptoms, but it doesn't treat the cause of asthma. So if you're using your blue inhaler more than 2 or 3 times a week on a regular basis, that's a red flag to say that your asthma isn't very well controlled. So you really want you to go back to your GP and or to your practice nurse to find out if there's anything that we can do. So if we can increase your preventer inhaler, or maybe you've got hay fever and that's really flared everything up. So when you're talking about using the blue inhaler, it's just relieving any of the tightness of the muscles around your airways. So that's all it does. It relaxes them. And someone once said to me that all the blue inhaler does is it buys you time until your preventer works, and that is really key. So really taking your preventer every day is key for your asthma care to make sure you keep that inflammation under control. So if you then do get hay fever, you don't run into problems. I'm just going to go back to this slide in a minute. I want to go to the treatments for hay fever first of all. So really, we want you to have a non-drowsy antihistamine. So that could be cetirizine, it could be loratadine, or it could actually be something called fexofenadine as well. Fexofenadine you can take from the age of 8, and it's a really good antihistamine tablet. So others you can get in liquid forms, but we really don't want you to have the drowsy ones, not the ones that make you drowsy. So that's really key for hay fever treatment, and to start it early. So you can have also, I've spelt nasal spray wrong, I've just seen that. So a nasal spray is often another treatment that you can have for hay fever as well, and also eye drops. If you're getting a lot of eye symptoms, you can have eye drops that will relieve that itchiness as well. You can also get balms, so you can get like their Vaseline or petroleum jelly balms, and you can just put them around your nose or your child's nose before they go out to school or before they go out to play. And that is the idea of that, is that the pollen actually sticks to the balm rather than actually going into the nose, where it's going to kick off all of those histamine like cycle. Air purifier, there is some people say that air purifiers work, but they're expensive, so you don't go out and rush out and buy an air purifier. Do all of the cheaper things first to see if they actually work. But some people do say that air purifiers work in the home. The main thing with hay fever is that it's mainly when you go outside that you have those symptoms, when you're in contact with that pollen. So that's sometimes people who have cut flowers in their home may find that actually triggers their hay fever. So obviously working out that if you've got a child with hay fever, maybe don't have too many cut flowers or bouquets of flowers at home. You can also wear sunglasses, or getting your children to wear sunglasses is a good way of just getting an extra barrier against obviously pollen going into their eyes. During COVID, a lot of people said that their hay fever symptoms were better, and this may be because we were wearing face masks more, so actually that pollen didn't go into our noses or our mouths. Showering when you come in from the day, or getting your children to shower when they've come in to play, getting them to wash their hair, so you're washing that pollen off, so you're not bringing it with you and it's not staying around, so that you can breathe it in and again and again. So and also there's a rule of thought to actually in the summer, we do want to open windows at night, but actually keeping those windows closed, so you're keeping the pollen in outside and you're keeping inside a pollen-free area as much as possible. And also, if you're washing clothes outside as well, just to be aware of what times of the day is the highest pollen count if you're drying clothes outside. So taking the washing in at a time when the pollen count is low as well. So if we go back to that other slide and how to take a nasal spray. So this is really key for your asthma care and also your hay fever care. So if you're on a nasal spray, you need to take it regularly. And if you're on a preventive medication inhaler for your asthma, you need to take that regularly as well, unless you're on a MART regime, which is a different regime when you only take your asthma inhaler when you've got symptoms. But that is usually from the age of 12 plus. So and you can talk to your GP or your practice nurse about that as well. So if you're taking a nasal spray, we really want you to take it the right way. And a lot of people don't really understand where the nasal spray needs to go, and will often pop it in and do a big spray and really sniff up. If you sniff up too much, then basically you end up just swallowing medicine. So when you're doing your nasal spray, we really want to get the medicine into this part of our nose here. So we say use the opposite hand to the nostril that you're going to use, stick it up there, and you're kind of aiming for the ear. So that's where you're aiming for. Do a squirt up there and it will come out. So you don't do a big sniff, you just breathe normally and you just squirt it up there, and some of it will drip out, and that's meant to happen. And then you will do it the other way round onto that nostril here. And as I say, you're trying to get to this area here and then leaving it. So then brush your teeth. So have your medicine with your toothbrush, so it just helps you to remember to take it. And then you can brush your teeth afterwards, and then you can give a wipe after that. We do say when taking a nasal spray, the first thing I forgot to say was blow your nose before you take it, because you're going to want to blow your nose after as well. But it's best to leave it as long as possible, to not blow your nose after you've just taken your nasal spray. So take-home messages really from this webinar is to start your hay fever treatment as early as as soon as your symptoms start. Don't leave it until your symptoms are really flared up. Try and be proactive and try and get your medicine and your hay fever treatment started really before you have your symptoms of hay fever. Allergy testing, go to your GP and your practice nurse and see what allergy testing is available in your area, so that you can get allergy tested and see what actual pollens you are allergic to. If you're asthmatic, take your preventer medication when it's prescribed, and also as soon as those asthma symptoms start to play up. We know that with children's asthma, that your asthma doesn't stay the same every day, that it is episodic, and it also varies as well. So really making sure that you're alert to your asthma's changing, and listen out for your child coughing. Are they coughing in the morning? Make sure that you give them their preventer inhaler, and also if their symptoms are getting worse and you're using the blue inhaler more than you normally do, then or more than 2 times a week, then make sure you go to your practice nurse or your GP to say that your asthma is uncontrolled. And keep your hay fever medication by your toothbrush as well as your asthma medication, and it will just give you that trigger to remember to take it as well. There's also lots of information on the Healthier Together app. This is the Frimley's app that we've got, and there's it can be translated into 150 different languages. There's a recite me function on it as well, so it will talk all of the information that's on that page. And anyway, for any health professionals, there's also an SMS sharing link at the top of every page that you can send to any mobile phone. So really good source of information, and there's lots of hay fever and also asthma information on that site as well. The Breathe Easy app, this is the digital health passport. It's free to download. You can upload your asthma action plan, and it will send you alerts if there's a really high pollen count day, and it will just it's a really good, again, another useful tool that teenagers often like, because obviously you can download it to your smartphone, and it's got lots of information about asthma on that as well. Please scan the QR code if you can, and give me some feedback about the webinar, anything that you'd like to hear, or any feedback would be gratefully received. And thank you for listening.